Most men never realize that one simple habit during urination quietly strains their prostate every single day, and almost everyone does it without thinking. Gentlemen, if you're waking up multiple times each night, if your stream feels weaker than it used to, or if you finish and still feel like there's more left, these changes are real. They often trace back to a daily behavior that feels harmless but disrupts your bladder and prostate in ways most men never learn about. Today, I want to explain that overlooked habit and show you a healthier way to protect your prostate for years ahead. I'm Dr. Zara, with over 15 years of experience as a urologist and men's health expert. Across thousands of consultations, I've watched men tolerate discomfort simply because they assume it's part of aging. But age alone is rarely the culprit. More often, it's the way the body responds to long-term patterns we never question. Imagine your bladder as a muscular reservoir designed to contract smoothly. Urine then travels through the urethra, which passes directly through the prostate. As men get older, the prostate commonly enlarges. This is documented in clinical guidelines by the American Urological Association, which notes that benign enlargement affects the majority of men over 50. When the gland grows, even a small amount of pressure becomes amplified within that narrow passage. And this is where the trouble begins. When men notice hesitancy, a weak stream, or sudden stops, the instinct is to push with the stomach muscles, almost like trying to hurry the process. It feels efficient, especially when life is busy, but that push sends a pressure wave backwards, compressing both the bladder and the prostate. Over months and years, it irritates the gland, increases inflammation, and reduces the urethral opening even further. In some cases, the force actually pushes urine backward, leaving behind a measurable amount known as residual volume. Urologists check this using bladder scanners every day. Residual urine is not harmless. It acts like stagnant water, creating a perfect environment for bacteria to multiply, which is why men who strain often experience recurring urinary tract infections. And the cycle continues. Swelling leads to more blockage, more leftover urine, more nighttime trips, more fatigue. I've had countless patients who tell me, "I go, but I never feel finished." This loop is often the reason. The bladder muscle itself adapts in an unhealthy way. The detrusor, which is responsible for natural contraction, begins to rely on the abdominal push. Over time, it weakens, becoming underactive. This condition is well documented in European Association of Urology literature. Men feel urgency more often, but achieve less each visit. It affects sleep, energy, and overall confidence. Here's the truth many overlook. Urination is meant to be a release, not an effort. The solution is simple, free, and immediately available. It's a technique called relaxed urination, used widely in urology clinics to retrain bladder habits. The moment you feel the urge, go when you can. Once in position, focus on breathing. Allow the abdomen to soften and release. Let the pelvic floor relax. Instead of trying, simply allow. Your bladder is designed to do the work on its own. If the stream pauses, wait quietly for a few seconds instead of forcing. That small pause gives the bladder a chance to contract naturally again. Many men are shocked at how effective this tiny change becomes within days. For those already experiencing weak flow, dribbling, or nighttime urgency, I strongly recommend sitting. Studies published in the journal Neurology and Urodynamics show that sitting reduces pelvic tension and supports smoother, more complete emptying. Sitting doesn't diminish masculinity, it protects health. Another helpful method is double emptying. After you believe you're done, stay seated, lean slightly forward, and wait 5 to 10 seconds. Often a second small flow follows. This reduces irritation and lowers nighttime frequency dramatically. Some men worry that not pushing will cause more leakage afterward. In reality, pushing is the very habit that leads to dribbling. Patience and proper positioning are far more effective than force. In more advanced cases of prostate enlargement, procedures like prostatic urethral lift or temporary stents may help, but these are reserved for significant obstruction. Before considering surgery, nearly every patient is advised to correct urination habits first. I've seen men improve in as little as 2 weeks simply by changing how they urinate. Lifestyle matters too. Hydrate throughout the day, not late at night. Caffeine and alcohol irritate the bladder lining and are well-known triggers for nighttime urgency. Reducing them in the afternoon and evening can dramatically improve sleep. Consistency is what transforms the body's habits. Let's summarize clearly so these steps stay with you. Avoid pushing. Allow your abdomen and pelvic floor to relax fully. Sit if you're experiencing symptoms. Pause rather than strain if your stream stops. Try double emptying. Drink water earlier in the day. Limit caffeine and alcohol later. These small changes give your bladder and prostate the conditions they need to function naturally. If this guidance helped you, consider liking this video and subscribing to Winds of Thought, where we share practical, evidence-based health insights. Share this with someone quietly dealing with these challenges. You may help them avoid years of unnecessary discomfort. Your everyday habits shape your long-term health. Today, you've taken a meaningful step toward restoring comfort, confidence, and peaceful sleep. Take care, gentlemen.